Greetings from Blockbuster News, the latest news in cardiology. The first article today talks about the clinical value of beta blockers in patients with stable angina. In stable angina, a manifestation of chronic coronary syndrome, beta blockers reduce heart rate and myocardial contractility, thus reducing myocardial oxygen consumption, ameliorate the frequency of anginal attacks, and improve exercise capacity. Current management guidelines include beta blockers as a first-line management option for most patients with CCS and symptoms of myocardial ischemia alongside dihydropyridine CCBs. Comorbid angina and heart failure is a strong indication for starting with a beta blocker. Beta blockers are also useful in the management of angina symptoms accompanied by a high heart rate, hypertension with or without a RAS blocker or CCB, or microvascular angina with a RAS blocker and a statin. The next article is cardioselective beta blockade is generally well tolerated in practice and contraindications to this therapy are uncommon. Here we have the latest article on safety and tolerability of beta blockers. Importance of cardioselectivity. Beta blockers are a diverse therapeutic class and their individual tolerability profiles are influenced strongly by their pharmacodynamic effects across different adrenergic receptors. Bisoprolol, probably the beta blocker with the highest selectivity for blockade of beta 1 versus beta 2 adrenoceptors, does not block beta 2 adrenoceptors to an appreciable extent at doses in therapeutic use. Hence, side effects often attributed to beta 2 blockers are uncommon with bisoprolol. Cardioselective beta blockers can be used cautiously in patients with COPD or asthma, especially when there is a compelling indication for their use in managing cardiovascular conditions such as CHD or HF. For more such interesting news in the field of cardiology, tune into Blockbuster News from BlockPro. For abstracts, please contact our IPCA Cardanova representative.